Bismillahirrahmanirrahim. Assalamu alaikum. Today we will talk about evidence-based medicine. Our learning objective, we need to define what is evidence-based medicine. Then we will talk about 5 steps of how to apply the evidence-based practice principles to a clinical decision. And we will discuss about the importance of evidence-based practice. When we used to study as undergraduate, most of our teaching is based on clinical expertise. For example, we used to learn that if we have a patient with headache and fever, this patient may have a meningitis. And if we want to be sure, we have to check for signs of meningism to be sure that this patient has meningitis or not. Another example, any child who have cough and fever and who is tachypneic is most likely to have a pneumonia. But if we took those clinical expertise and we validate them based on research evidence, we may find most of them or many of them may be out of date, may be wrong, or sometimes invalid. For example, you may find up to 40% of patients who has meningitis has no signs of meningitis. Or you may find this expertise is valid. So if you have a child who has fever and tachypnea, yes, fever and tachypnea and cough are signs that predict that child is having a pneumonia. So if you combine your clinical expertise with best research evidence, you will have the most up-to-date and valid clinical expertise. But don't forget, not everything that you are expert to do or you are doing, which is based on the best research evidence, is applicable. So you have to acknowledge patient values, expectations, and preference so as to make the right decision. So evidence-based practice is an integration of your clinical expertise, which is validated on best research evidence, which is applicable and which is meet patient values, expectation, and preference. And this is the definition of evidence-based practice. So it is an integration of your clinical expertise with best research evidence and patient value. So this is evidence-based practice. So how can I apply evidence-based practice into my evidence-based medicine into my practice? So if I want to do that, I have to go through 5 steps. And to make it easy, we call them 5 A's for evidence-based practice. So you have to ask a focused question. You have to acquire the evidence. You have to appraise the evidence. You have to apply the evidence, and then you have to assess the process. So for example, if you find a patient problem which is related to a knowledge gap, you have to ask a focused question about that problem. Then you have to acquire the information. When you find the evidence written online, you have to be able to appraise the evidence. Is it valid? Is it important? Is it applicable? Then you have to be able to apply this evidence to your practice, and you have to assess the process. So the first A, asking focused question. So you will translate the uncertainty into an answerable clinical question. Then you will acquire the evidence. So you have to have a systematic approach to retrieve the best evidence online. Then you will appraise. You have to have the knowledge and the skills to critically appraise or evaluate any piece of evidence paper for is it valid or not, is it relevant, is it important, is it applicable or not. Then you have to apply it. You have to make the decision. Is this piece of evidence applicable in my setting or not? And then finally, you will assess the process. You will evaluate your process yourself, and you will audit your practice to improve your performance. Is it important to practice based on evidence? Yes. So if you go through every step, you will have a lot of benefits. So if you ask a clinical question, you will identify and you will report your knowledge gap, and that will serve like a learning need assessment. If you acquire the evidence, you will master the literature searching skills, and you will be able to get more information. If you know how to appraise the evidence, you will have a systematic approach to read the literature. And to do that, you have to identify and to remember basic research design statistical concepts. Then, when you apply the evidence, you will be able to appreciate evidence and practice improvement. And then you'll be able to communicate evidence with patients. When you assess the process, you will assess your current practice by clinical audit. Okay, so it's very important to practice based on evidence. So if you want to do that, what are the knowledge and skills that is required? Again, you have to have diagnostic expertise. If you have no clinical expertise, if you did not see a lot of patients, and if you do not take a good history, if you did not do a good physical examination, you will not be able to apply the evidence and even to recognize the patient problem. You have to have in-depth background knowledge. You have to have an effective searching skills. You have to have effective critical appraisal skills. So for that, you have to have a good knowledge for difference design and basic of statistics. Then you have to be able to define and understand benefit and risk alternative. You need in-depth physiological understanding that allow you to apply the evidence for individual. For example, research evidence which has been done on orthopedic patients on prevention of deep vein thrombosis are applicable to pregnant lady, except for warfarin because it doesn't work for pregnant lady. You have to have a sensitivity and communication skills that is required to understand the patient context. Then you should be able to elicit and understand patient values, preference, and apply them for management decision. Any question? Okay, so in summary, evidence-based practice is integration of best research evidence with expertise and patient value. It's very important, and you have to know the 5 A's for evidence-based practice. Thank you very much.